All right, turning to health news. Oh, my friend over here, did you know 50% of people who experience a possible concussion don't even get it checked? Well, let's see what experts are saying and why you should pay attention to concussion symptoms.
March is Brain Injury Awareness Month, and we know that concussions can happen to anyone, anywhere, at any time. Concussion awareness is so important because you can't treat what you don't know. And I can tell you as a neurologist, it's not always easy to know if you have a brain injury. If you twist your ankle, you can see that your ankle is swollen. You can feel that it hurts. But when you injure your brain, we call that an invisible injury. You can't see that your brain is injured. So, over to Kathy, who is the president of the National Athletic Trainers Association. Can you talk to us about some tips for parents and coaches on the field?
Athletic trainers are educated healthcare professionals who are there to assess injuries if and when they occur. We know that 300,000 athletes in high schools and colleges suffer concussions every single year. And athletic trainers can be there, have the knowledge and expertise to evaluate those injuries, but we have to be there. And we also know that 1/3 of high schools across the country do not have access to an athletic trainer. So I would ask parents and coaches, who's taking care of your children when they're participating in athletics? Because we know that recognizing concussions and treating them properly is what really protects the health and safety of student athletes. So, Beth, what are some of the myths? How do injuries occur, and what are some of the myths surrounding concussions?
Well, the #1 cause of concussions would be slips and falls, followed by motor vehicle accidents. So that brings us to our first myth. Myth #1, only athletes get concussions. In fact, the vast majority of concussions happen to non-athletes from slips and falls and just everyday accidents. Myth #2, people think that you have to lose consciousness to have a concussion. That's not true either. Most people will not lose consciousness when they have a concussion. And Kathy?
And myth #3 is you have to get a blow directly to your head in order to be concussed. And we know that a significant blow to your body as in general can cause that concussion as well. And from a sports standpoint, it's often believed that male athletes incur concussions more often than females, and it's just the opposite. 2 to 3 times more concussions occur in women. So treating athletes individually, recognizing those symptoms, and getting them appropriate care is critical to the recovery from a concussion. And to have more information, Beth, where should they go?
Well, you should go to concussionawarenessnow.org and stay tuned because we have a new public service announcement coming out soon.